Hello, I'm Dr. Anthony Wheeler, and I'm telling you everything that you need to know about pathology. Now, if you take a look at this cartoon here, we have the anterior pituitary and the posterior pituitary. And out of the picture, we have the hypothalamus. Now, we're going to be talking about posterior pituitary gland pathology. This is covered in your book, Medical School Pathology and Step 1 Review. You can scan the QR code to get to the updated material. Posterior pituitary gland pathology. Now, as we know, the hypothalamus produces oxytocin and antidiuretic hormone, ADH, which are subsequently sent by axons to the posterior pituitary for release. The distal tubules and collecting ducts of the kidney are affected by antidiuretic hormone, ADH, which encourages free water retention, hence the antidiuretic effects. The release of breast milk, known as letdown, in breastfeeding mothers and the contraction of the uterus during childbirth are both mediated by oxytocin. So specific posterior gland pathology that you must be aware of includes central diabetes insipidus, and as a caveat, nephrogenic diabetes insipidus, and syndrome of inappropriate ADH secretion. So, here we have a cartoon of a posterior pituitary comprising the posterior lobe of the pituitary gland. Thanks so much, Dr. Gray. Now, another cartoon showcasing the posterior pituitary comprising the posterior lobe of the pituitary gland. It's a lot of P's. But can you see it there? Do you see the posterior lobe? Do you see the anterior lobe? Okay, now do you see the posterior lobe? So let's talk about central diabetes insipidus, right? Very important condition. Central diabetes insipidus results from antidiuretic hormone deficiency. Central diabetes insipidus occurs due to hypothalamic or posterior pituitary pathology, such as tumors, right? It can have a massive growth there, inhibiting normal physiology. Trauma, right? If it's involved in some sort of collision, fracture, disruption. Infections, right? It can have bacteria in there causing havoc, running amok. And inflammation, right? All these are issues that can lead to central diabetes insipidus. Clinical characteristics of central diabetes insipidus include polyuria, polydipsia, dehydration, even though they're drinking a lot, right? Hypernatremia, and low urine osmolality and specific gravity. Central diabetes insipidus is diagnosed by failure of a water deprivation test to raise the urine osmolality. Central diabetes insipidus is treated with Desmopressin, which is an antidiuretic hormone analog. Okay, what about nephrogenic diabetes insipidus? Well, nephrogenic diabetes insipidus is due to impaired renal response to ADH, right? Nephrogenic diabetes insipidus is due to impaired renal response to ADH. Common causes of nephrogenic diabetes insipidus include inherited mutations, lithium medication, right? So look out for psychiatric conditions in the patient's history in real life and on board examinations and vignettes, etc. And for the gunners out there, don't forget demeclocycline can also be involved with nephrogenic diabetes insipidus. Desmopressin, as you know, has little effect despite having clinical characteristics that are comparable to those of central diabetes insipidus. Now, let's talk about syndrome of inappropriate ADH secretion. This is due to an excessive ADH secretion, right? It's inappropriately secreting too much ADH. Causes of syndrome of inappropriate ADH secretion include small cell lung cancer, right? That's the most frequently brought on by an ectopic production. Central nervous system injury could do it. Pulmonary infection even. And medications such as cyclophosphamide. Symptoms of syndrome of inappropriate ADH secretion include hyponatremia and low serum osmolality, mental status changes, and seizures. Hyponatremia results in neuronal swelling and cerebral edema. And treatment of syndrome of inappropriate ADH secretion includes free water restriction, no more sips for you, and demeclocycline. And with that, you completed a short and sweet presentation on the posterior pituitary gland pathology that you must know. Your knowledge is being cemented, increased. You're a machine. Keep up the good work. You're making everybody proud. And until next time, take care.